Joint replacement is becoming more common among baby boomers, and procedures are requiring less downtime. Dr. Edgar Handel of Boca Raton Community Hospital joins us this afternoon to answer your questions. Thank you so much for your time. We really appreciate it. We are seeing replacements becoming more and more common among the baby boomers, aren't we?
Absolutely.
Are there new joint replacements, Dr. Handel, or are they becoming just better procedures?
I think it's a combination of both. The techniques that have evolved have gone from more of a maximally invasive procedure with bigger incisions, more muscle trauma and tendon trauma, and now we've gone more towards minimally invasive surgery where the incisions have become smaller and the approach is not necessarily going through tendons that take longer to heal, but more of a splitting through muscle procedure. And the downtime and the earlier recovery, the downtime is less and it's an earlier recovery, and patients experience less pain or getting out of the hospital quicker and getting back to a more normal lifestyle.
I have a friend in her late 50s, had hip replacement and has had no complaints. Just was home with a cane and went back to work and just said it was a breeze. And she was so surprised because she had remembered relatives years ago having hip replacement surgery. And you really were down and out for a while, weren't you?
Yes, it's amazing the advances that we've made in the field itself, both in hip and knee replacement.
A man called with a question about his knee and wants to know, at what point do you know you need a replacement?
Well, when the patient starts experiencing pain or notices that they started having a deformity in the knee specifically, you will know that something's going on. The best thing is to consult either a rheumatologist or preferably an orthopedic surgeon to get a set of x-rays and to find out what your status is. The treatment of this always starts off conservative. We like to start with some anti-inflammatory medication, perhaps the use of a cane, a cortisone injection, and even some nutraceuticals that are out, glucosamine sulfate, chondroitin sulfate, and some injectable forms of that material as well. But evaluating the x-rays, perhaps an MRI even, you can go all the way from knee arthroscopy, which is the most minimally invasive surgery, all the way to a full-blown knee replacement.
And when do you know?
Well, basically with the symptoms. The patient quality of lifestyle starts to diminish. They stop playing golf. They stop doing their walking in the morning. Those are the most typical complaints we see in our age population.
And that's a knee replacement, but you replace everything from shoulders to ankles, right? And everything in between?
Absolutely. Well, some of that other people do, but orthopedically,
yeah.
Shoulder, hip, and knee are the most common, and ankle is the least common. It happens in rheumatoid arthritic patients mostly.
And we have the knee replacement and the hip replacement here, but knee replacements are gender specific now too. Women, it actually can be accommodated to the female leg.
Absolutely. In the past, the women have complained that their knee looks bulkier than they'd like it to look, so this is almost a cosmetic solution to that. And basically what it is just more size availability. Particularly from the width of the knee replacement.
But that has never been the problem with hip replacement.
No, it's not a gender-specific issue with hip replacement. But there have been design changes in hip replacement which have improved and enhanced the stability of the hip replacement so that the patients have fewer and fewer complications post-operatively.
More good news on the replacement front, Dr. Handel. Thank you very much for your time this afternoon. Boca Raton Community Hospital sponsors our expert for today's segment and also sponsors Ask the Doctor. We're back with more in just a moment.